Tell us a bit about the healthcare challenges that you have dealing with AI and providing sort of solutions and innovations.
Yeah, I mean, if you look at the healthcare space right now, there's tremendous amount of investment in AI solutions, and it's incredibly promising. It has a promise of solving for a lot of the challenges around access, as well as around creating capacity within the healthcare system, so allow us to control cost of delivering care, as well as reducing variation of care and help us improve patient outcomes. One of the biggest challenges around AI development right now is the access to data.
Yeah.
So if you look at a healthcare organization today, data is in multiple silos, and it's challenging for clinicians to access to, and it's also challenging for industry to be able to get that data and be able to develop the algorithm with the right level of accuracy.
It's highly fragmented.
Exactly. It's a highly fragmented environment today. We talk to hospitals where they have over 120, 200 IT systems, and the data exists in silos.
So a lovely opportunity for you to figure out how to bring it all together.
Exactly, and how do you thread this data, and how do you connect it to make it relevant? The human body is complex. Typically, if you watch a clinician in their diagnosis or therapeutic steps within the care pathway, they don't rely on data from a single source. They look at an entire picture of the patient to arrive to the right decision making. And for that, there's a big opportunity for us to break down those the silos, be able to take the data and unleash the power of intelligence by building algorithm that leverages the multiple sources of data to aid the clinicians in their diagnostic, therapeutic, or monitoring care pathways.
And do you do this on your own, or do you bring partners in to do it?
Yeah, we're definitely looking at bringing partners in. So we have, and there are multiple ways that we can partner within the ecosystem. So to be enabled and facilitate this partnership, we invested heavily in the Edison platform. The goal of Edison platform is, number one, is to break down the silos and unleash the power of data. Be able to aggregate the data in a way that we can build intelligence within GE and eventually also with external partners. The second aspect of the Edison data ecosystem is allowing us to partner with, for example, with companies like AWS, with Amazon, to leverage some of their AI technology capabilities, and allowing us to bring in algorithms that are specific into the healthcare space.
Gotcha, absolutely. That sounds incredibly interesting, but very difficult. How do you convince providers to give you that data to work with you?
The opportunity for us here is to co-create with our customers. So we have a lot of clinical partnerships that we have done. About 2 weeks ago, we've gained FDA approval for one of the algorithms that we have partnered with UCSF in developing, helping kind of address a critical care situation with collapsed lung around pneumothorax.
For those of us who are international, UCSF is?
University of California in San Francisco Medical Center.
Fantastic.
Yes. So we have partnerships across the world, and the scale of GE have actually enabled us to get in the forefront of this and be able to partner with various Ministry of Health, various academic institutions, as well as private institutions.
Are you allowed to talk about some of the ministries you've partnered with, or is that?
You know, a lot of this continues to evolve,
right,
and we actually look at the ecosystem as not only just GE. The idea behind the Edison ecosystem that we're creating is that we can also invite other startups, industry partners, that we can together co-create with our clinical partnerships or clinical customers to make sure that we solution across the enterprise.
And you're a global company outside the United States. What territories are interesting for you? Where are you working in?
Yeah. A lot of our presence in Europe, in APAC region, so Asia Pacific is actually an important region for us here, and it's exciting to be in the region. A big part about making sure that we're creating the right level of solution for our customers when it comes to AI is ensuring that we have high volume of data, but also ensuring that we have variety of data and relevance to the data. The variety of data is incredibly important because it ensures that we are creating AI that is not biased. So in all of our partnership, we are looking to basically partner on a global scale to make sure that the algorithm that we develop will be adequate for workflows that are in the US, in Asia Pacific, in Africa.
Absolutely.
And genetic disposition kind of creates different risk factors for all of us. So it's very important that the AI is not biased, and a big way to do that is having a large-scale partnership, so you're able to access to large volume of data with a lot of variety, data that is also relevant to the problem that the AI and the conditions that AI is trying to predict.
It's only as valuable as the data you put in.
Exactly.
And so you need to put a lot of data in, it needs to be diverse,
Yes.
so it's not biased.
Yeah.
Yeah.
Absolutely, and it's got to be relevant as well.
Yeah. So are you allowed to tell us any of the countries that you work in terms of accessing the data? Any of the partnerships, the hospitals, the providers?
So a lot of this is works in progress depending on the various projects. We operate in 60 different countries,
Right.
and we're looking at opportunities all over the world.
Yeah, I'm trying to pull out one
Yes.
country, but I can't get you to tell us the country, huh?
Yeah.
You work in Singapore, for example.
Not at this point,
Not at this point.
but we have operations. We're recruiting top talent within the data science. So we have data scientists sitting in Latin America, in North America, in Europe. We've also in Japan. So we're looking at a broader ecosystem that really allow us to make sure that we're reaching our global customer base, since our solutioning tends to be global in nature.
Yeah, absolutely. So it's innovation is very hard to do, as we know. It's very hard to do it in a big company. Big companies are typically not structured for innovative solutions. Oftentimes they go and buy the solutions outside, so what you're doing is quite unique, difficult to do. How do you encourage that innovation within GE?
It's a combination of making sure that we have the right platform and tools that allow us to tap, specifically for AI development, that allow us to tap into the data sets that we need. So within the Edison platform, we develop over 100 different services.
Wow.
That would allow us to co-create with customers and leverage those services to expedite innovation, expedite solution delivery. And the other part is really around co-creating with customers, is partnering with customers to bring in the clinical aspects. We've had customers who brought in their data scientists to complement the data scientist teams from GE. And being able to kind of have a defined customer problem and solving for it from the eyes of our customers.
So can you talk a bit about some of the outcomes that you've gotten with your AI products?
Yeah, absolutely. I'll use the critical care suite on our X-ray system as an example of that. So within this algorithm, number one, what we wanted to do is reduce variation of care. So a lot of, if you if you're a patient in the ICU, or if you present in the emergency room and they suspect a collapse in lung, you typically do a chest X-ray. And the positioning of the imaging depends very much on the technician and their skill set and their training. So the algorithm will actually guide the technologists to make sure that they've got the right position and the right labeling of the anatomy.
Gotcha.
Our retrospective data showed that there's about 7 to 10% mislabeling of the anatomy. So the algorithm will run, make sure that you have the right position for the patient, and you're able to do that quickly. And then from there, the algorithm also will proactively detect any pneumothorax and help prioritize those results, so you're engaging the right clinical team at that time.
So does the AI remove that 7 to 10% error?
Correct. So basically, it would guide the technologists to make sure that they've got the right positioning and the right labeling of the anatomy.
Fantastic.
And after that, it would basically do a preliminary kind of condition diagnosis and would suggest findings that would enable the technologist to engage the right clinicians, bring in the radiologist. So today, for example, you're dependent on the technologist's skill set and their ability to capture the right position, and sometimes with challenging patients, this is very difficult to do. And then after the exam is done, you're dependent on the radiologist and kind of falling into their queue to be able to read the exam and detect the results.
So by improving the diagnosis, you definitely improve the outcomes.
Exactly.
You got the right information going in.
Yeah, the right information for the right clinicians to allow us to deliver the right level of care for the patient by the bedside.
Fantastic. So over the next 5 years, put on your future hat, and what do you see for AI? Many people get scared about it because they see a black box machine. They don't know what goes in it, and they're not sure what's coming out of it. So AI is quite scary for people. But given that, what do you see as the future of it, given all the stuff that you've done at GE and what others are working on?
Number one is, I think as an industry, we have a responsibility to be more transparent, to educate, to be more transparent, to ensure that we've established ethical principles around developing AI at GE. I think we were one of the first healthcare.
Do you have a system of ethics that you
exactly.
Oh, you do?
Yeah,
Okay.
to make sure that the AI is not biased to a specific patient population, to make sure that it's transparent. You know, as a patient, I expect my physician to explain to me their process of decision making, and we should expect the same from the algorithm.
Yeah.
And so that is actually number one. So kind of education, and over the next 5 years, we expect that the anxiety and the uncertainty around AI, with the right level of transparency, with the right ethical practices around developing AI, that would, and the right education, that would go away. But one of the biggest challenges remains is how do you take AI and basically infuse it seamlessly and invisibly within the different software applications and devices in the hospital setting?
It's difficult.
Absolutely. Yeah, and we talked a little bit about how hospitals and health systems have hundreds of different systems that data sits in silos in it. So kind of breaking down those silos, making sure that data is available for the clinicians to make their decision making, for industry to develop the artificial intelligence, as well as for the AI application to be able to leverage that data to run and provides the results, is also another opportunity that is ahead of us.
Interoperability with data all around the hospital is such an important thing.
Absolutely.
It's a big topic these days.
Yeah, so at GE Healthcare, our vendor neutral archive, Centricity Clinical Archive, we manage over 75 billion images of patients globally.
A lot of images.
So for example, a large portion of images in Singapore are managed through GE Technologies and our VNA with Centricity Clinical Archive.
I got you to mention the country.
Yes,
there you go,
absolutely.
Singapore. Fantastic.
Yes. And then a big opportunity for us over the next 5 years is helping clinicians in their adoption and making sure that they're able to vet out the different algorithms.
Yeah.
If you look, there's tremendous amount of funding going in, great innovation in it, but with that, there's to make sure that we're able to adopt it in clinical practice and it delivers on what the clinicians are expecting to, providing a level of a silent pipeline that allows you to vet out the different algorithms that are coming from various different vendors, become an important step in making sure that the clinicians have an ability to integrate AI seamlessly into their workflow and make sure that it's appropriate for their patient population.
And getting them to buy into the program, buy into the output is so important because you want them to use it.
Exactly.
It's for them, it's for the patients.
Yeah, and you need the clinicians and the physicians to own the decision in terms of, is this appropriate? Is this application truly bringing intelligence to their workflow? Or is there more learning that this application needs to do before they're able to integrate it?
Mm-hmm. So looking around the world, because you work globally, if you had a magic wand and you could wave the magic wand and get rid of one problem, address one issue in the healthcare industry, maybe about AI or whatever, what would it be?
I think breaking the silos of data within the healthcare enterprise is a big initiative for us. Being able to have this data that is normalized for the patient, that is accessible, it's going to fuel innovation for us. If you look across the industry, everybody's talking about data being the new oil. And within healthcare industry, we have responsibility for our patients and our providers to make sure that we're managing this data appropriately so we can fuel innovation and it's relevant to our patient population.
That would really help it take off, wouldn't it? That would be amazing.
Absolutely.